So in every level, we are collecting information, and the specialist of every level should report in electronic surveillance systems, which they are really struggling because the middle age of epidemiologists in Ukraine is 50, which is really senior age level, and it's complicated to tell people how to use it without proper training. And the main organization, which is leading CDCs, is called the Health Center. And there was the main thing which Public Health Center noticed was in 2024 when they collected information about West Nile diseases cases, and they noticed what it was much higher rather than the previous years. And as in 2023, it's only launching the electronic surveillance system. So in 2024, they started to apply the information there on a regular basis. So maybe this is the main thing why the number of cases increased really fast. Or another situation which may be is the changes of the overall climate in Ukraine, because the middle age temperature remain higher and higher, especially in the east of Ukraine. But here we want to mention what we are collecting information about only civilians, so the civilian population. But the most of the cases of vector-borne diseases nowadays is based in the east of Ukraine, because the main population there nowadays is soldiers. And the information about the diseases and new cases of soldiers is not collected in a regular way. And the Minister of Health of and Department of Health of Ministry of Defense of Ukraine don't have any electronic surveillance system or any electronic system to collect new cases of infectious diseases. So their cases of rare diseases, for example, in 2024, West Nile remains be unknown. And it would be unknown because the type of collecting every type of diseases is uncertain there. So in this situation, we decided to research how many actually epidemiologists present in Ukraine, because its information will remain unknown. And in every level, there's like an imbalance, because in the local level, the number of assistants of epidemiologists may be twice higher rather than epidemiologists, but epidemiologists is the main person who can lead field working group or like a research or an investigation of cases of diseases. In the national level, the number of epidemiologists and statisticians, assistants, administrations remains being really low. You compare this with the regional local level, but the national level, this is the only level which are regulating the work of electronic surveillance system, and they are leading the investigation of really complete cases of infectious disease outbreaks, especially in terms of vector-borne diseases. So there is a distribution of epidemiologists in the card, and we can see what in some regions the number of epidemiologists it's really low, or some regions doesn't report in the cases like the number of epidemiologists properly, and we should understand what the east regions nowadays is under temporary Russian occupation, and epidemiologists who, for example, working in these regions, they just have like regular payments, but they can't do any type of researches, and the number of cases of vector-borne diseases is just when the IDPs migrating really suddenly, way fixed like they were in a Lugansk or like a Donetsk region, but they normally live in another city. This is another problem of electronic surveillance system nowadays, because the case of the person who have the vector-borne disease is remains being territory that a person originally born. So based on this, we can understand what the main problem is, how to combine the different type of data and databases from different sources for vector-borne diseases and new cases of infectious disease, and to create standardized forms for reporting from the Department of Health, Ministry of Defense of Ukraine, about the number of cases, about the personal information of a soldier who will be under this case, and maybe to create a standardized ID code for every person who maybe is the soldier, and remain be applied to epidemiological surveillance system of civilians. So the main conclusion which I want to say for this presentation, this is what addressing workforce shortage and the low attractiveness of epidemiology as a profession must go hand in hand with technological modernization, because, as I mentioned, most of the people who work in epidemiology, it's the senior population, and the new epidemiologists, young, may be really low because of the low level of attractiveness and the low level of grants for epidemiological research in Ukraine. And GAPS highlights the urgent needs to apply AI or machine learning models for the forward data sets, which may be standardized. Because with that tendency, the number of young epidemiologists would be lower, and the people who will have capacity to apply machine learning for the data sets would be 10 to 0. So it makes sense to apply some basic machine learning models for the data sets from epidemiological surveillance system to predict any type of diseases, and developing a dedicated surveillance model for vector-borne disease infection would be enabled to real-time monitoring transmission dynamics, improving outbreaks protection, and optimize resource allocation, as I mentioned, for example, for salaries. So it's main thing. Thank you for listening to me, and this is really great research for Ukraine. Thank you.
Thanks, Valeria. We've got loads of time for questions, so hopefully we're feeling creative. I would like to start by asking, so you talked about strengthening digital literacy. How do you think we could do that?
Yes, actually, for usage of for epidemiologists, and like a smaller is only like 5% of epidemiologists in Ukraine using even the basic statistician programs, for example, R or Python programming. It's been really low for usage. Mostly they use like Excel or really basic tools which can enable any type of optimizations or like a prediction models. So.
Thank you. Any further questions? One here.
Thank you. Which vector-borne diseases were included? You just mentioned the West Nile and some hemorrhagic river. Were there any other, or are these vector-borne diseases mandatory reportable in Ukraine? Mm-hmm. Are you focused on this mandatory reportable, or?
We have a list of mandatory of infectious disease, what should be mandatory reported, and they included in an electronic surveillance system. They are the same as there's a list which should be aligned with EU mandatory reporting diseases only because it's the main thing for Ukraine to apply for EU, for example. And the number of vector-borne diseases which are reported nowadays with mandatory reasoning is remain below. So the cases of, for example, specific diseases or which is not worthwhile reporting, under worthwhile reporting, it's been low, and they only nowadays collected in a paper-based form. So there's no evidence in electronic system, and this is another problem of this.
Okay, but this is like Lyme disease.
Lyme disease is mandatory collecting West Nile, most types of fevers.
I guess tick-borne encephalitis.
Yes, encephalitis. And interesting thing, what Public Health Center noticed this season, what the activity of ticks it started be earlier rather than previous years for this year, and it's maybe somehow predictable by at least analyzing like a trend over like 10 years, but because we have a really small amount of data, it's remains to be able to process it.
Maybe at the front here?
You were mentioning that there are some technical or official limitation from technical knowledge to report data as well as sensitive data. And do you think about the points in some type to help to collect data and make it easy?
This electronics, thanks for the question. And this electronic surveillance system is like for usage only from the laptop. There is no app. But for studying people to use this, there's a limitation with a financial component. It would be great maybe to develop some programs or apps for at least usage of it. But there's only capacity to apply trainings. Like even once of the year when the program was launched, there was a series of training, but we can understand what to really apply the knowledges. It should be on a regular basis for new people, for example, who is coming on the field and they are on their senior age. So maybe it makes sense to apply the approach with community learning. Then new person is coming. Would help in the right way. But this electronic system is a good thing. But this most of the stuff is standardized and should remain help them to apply data more correctly and without any during not gaining any new complicated knowledges like the programming and stuff. What I think the best approach would be for the start, maybe the years till end of the war, it's the community learning approach.
And Kelly?
Thank you, Victoria. Great talk and great explanation for the answers. I'm an applied entomologist and I'm working with mosquitoes, and I'm just wondering if epidemiological data are somehow connected to mosquito control programs, and who is running these programs?
Thanks for the question. Another limitation, what we have, the systems in Ukraine, and for example, ecological system like climate monitoring departments or ministries, they not communicating mostly with each other. So if they even collecting data, they collecting it in their way,